HD continues here on WCIA 3, your local news leader.
A student on the U of I campus has been diagnosed with bacterial meningitis. Now, Dr. Nathan Walker from Christie Clinic is here with us tonight to talk about it. And Dr. Walker, this student was diagnosed with bacterial meningitis. There's also a viral form. What's the difference here?
Bacterial meningitis is the one that you hear about, the one that people die from, very serious, very fast moving. People present with severe symptoms, so it's usually one of the worst headaches they've ever had, and their neck is oftentimes stiff as well. Not just stiff like I have a cold and I can't turn my head all the way, they really can't bend their head down such like that, and almost always they have a fever. They look sick. It's very easy to see. Viral meningitis, on the other hand, can be kind of not so bad. They may have a low-grade fever, they may be disoriented a little bit. It's a lot more common and it's a lot less dangerous. There's usually no antibiotics that are necessary. There are certain forms of viral meningitis that you can use an antiviral for, but it's kind of rare. Those people may just present with low-grade fever that's kind of indolent, maybe over the course of a week or two, and maybe some mental status changes, whereas this bacterial meningitis, it's usually onset is one day. And
how is this spread, the bacterial form?
It requires close contact. So you and I sitting here right here, that's not going to be enough unless we do this for 8 hours.
Okay.
8 hours, then we would pass it. But sharing a spoon, close contact, obviously, like sharing, eating together or kissing, something like that, those people only need that small amount of contact, but usually it's kind of close proximity. So this is often one of these that goes through a dormitory or barracks in the military, for instance, and that's why they will require everybody at the university, for instance, to have that vaccination prior to attending.
Okay, and we have about 30 seconds left. What can I do to protect myself to try and make sure that I don't catch this if it does spread?
You should wear a mask. No, I'm just kidding. You don't have to do that.
Okay.
Really, unless you are in very close proximity with the person that was diagnosed, you don't need to do anything. Bring it to your attention of your doctor if you have a severe headache and fever, especially with the neck stiffness. That requires going to the emergency room. Don't put a call in, just go straight there.
Okay, good information there. Dr. Nathan Walker from Christie Clinic, thank you for coming in. We'll be right back.